The aim of this video is to discuss the use of computed tomography scans or CT in medical imaging. If you are having a CT, we hope that this will answer any questions that you may have. You should also read through the information that you will receive from the hospital you are having your scan at. You may be referred for a CT because you are feeling unwell, because your doctor wants to follow up some test results, or as part of a screening or research programme. You will have been referred for a CT because a healthcare professional who has reviewed your clinical history has decided that they need additional information that can be obtained by using a CT to look inside you. Before the CT goes ahead, an imaging specialist will look at the request and decide whether it is the right test for you to have to find out why you are feeling unwell. They will then pass the request to a highly trained radiographer to carry out the scan. CTs use X-rays just like X-rays you may have had at a dentist or if you've ever broken a bone. With the CT though, the X-ray machine inside the scanner spins around very fast and takes images from all different directions. This allows a computer to produce an image which is in 3D rather than 2D. To allow the X-rays to take images from all different sides of you, you will have to pass through what we call the bore of the CT. Some people imagine this like a tunnel, but actually it's more like a donut that you pass through. You will always be able to see around it. As you can see in the video on the screen, the spinning X-ray machine is hidden inside the scanner so that you will not even know that it's spinning. The scanner is also very quiet. If you've had a scan in the past and it was loud, this is more likely to be an MRI scan, which is a different type of imaging. The radiographer will sit outside the room during the scan, but will be able to see and hear you throughout. When you arrive, you may be asked to change into a patient gown. This is because metal items such as zips show up on CTs and could cover up what we're trying to see. Some CT scans require preparation, so you will be asked to attend the hospital in advance of having your CT. You may be asked to drink water or have a needle put in your arm to allow a liquid to be injected during the scan. The clear liquid is called contrast, and this improves the scan pictures by helping us to see your blood vessels and organs. Most appointments are finished in less than 90 minutes. For example, a head scan will be around 15 minutes and a full body scan around 30. However, it will depend on the amount of time required for preparation. You do not need to stop taking any medication before your exam, but ensure that you bring with you any medication, sprays, inhalers, etc. to your scan appointment. If you have diabetes, please tell the radiographers on arrival. When it is time for your scan, the radiographer will lead you into the room and ask you to sit on the couch.
Hi, would you like to come through? Just take a seat on the bed for me.
They will then ask you some questions to confirm your identity.
Could you please confirm your name, date of birth, and the first line of your address, please?
You may also be asked if you could be pregnant if you are of childbearing potential between the ages of 10 and 55 and if your scan is going to include the abdominal area. It is important if you could be pregnant that you tell the radiographer before the scan happens so that they can ensure that it is the right scan for you and the baby. You will then be asked to lie down. Once you are comfortable, the radiographer will then raise the bed and then move the bed into the scanner.
I'm going to move the bed up and into the scanner, okay?
The radiographer will then talk you through what is going to happen during the scan. However, during the actual scan, they will need to leave the room, though they will be able to see and hear you throughout the whole scan. Whilst appointment time is usually between 10 and 30 minutes, sometimes 90 if you need to drink before your scan, the actual scan is very short. You will need to stay still during your scan so that the images aren't blurred. There will usually be 1 or 2 short scans to ensure you are positioned correctly first, followed by a longer scan that will last around 20 seconds. You may also have more than one scan during your visit, but the radiographer will inform you of this beforehand if this is the case. You may be asked to hold your breath during the scan, and this will be discussed with you before the scan, and you will also be instructed when you need to hold your breath over the intercom system. In this clip, you will also be able to hear the sound of the CT whilst it's scanning. As mentioned previously, it is very quiet.
Take a breath in and hold it. You may breathe normally.
These instructions are available in different languages, so do let the radiographer know before the scan if you would prefer these instructions in another language. If you think you might struggle with holding your breath during the scan, just let the radiographer know beforehand. As mentioned before, the radiographer will be able to see and hear you throughout your scan. The contrast agent contains iodine and is excreted in your urine by the kidneys. Please tell the CT staff on arrival if you are allergic to iodine, have any other allergies, or suffer from asthma. If you have reacted previously to any intravenous contrast agents, the dye used for kidney x-rays and CT scanning, or if you're on renal dialysis, have any problems with your kidneys, or are seeing a kidney specialist. You may feel warm and potentially sick during the injection, but this should pass in 1 minute. The natural risk of getting cancer in our lifetimes is approximately 1 in 2. CTs are typically associated with an additional risk of less than 1 in 1,000. Almost everything we do in life comes with a risk, and the CT you are having is to help to diagnose a health issue. It has been determined by 2 healthcare professionals that the risk to you from having the CT scan is less than the risk of not having the exam. Another way to think of this is the benefit to you from having the scan outweighs the small risk of having the x-rays used to do the scan. Often, the alternative to imaging is to have exploratory surgery. Because of imaging, this is now uncommon but is associated with higher risks. At all stages in your care, everyone works together to reduce the amount of radiation you get to the smallest possible amount.
As the referrer, I ensure that I have a clinical question that I need the answer to in order to provide the best possible care for you. I also ensure that no other tests, such as ultrasound or MRI, which don't use x-rays, could give me that answer.
As the radiologist, I ensure that the benefits to you are greater than any risks before I allow the scan to go ahead.
As the radiographer, I make the best use of my equipment to get the information to answer your health question.
As the radiologist, I provide a report that answers the referrer's question.
As your doctor, I can now decide on the best way to look after you, my patient.
Whilst the radiographers are highly trained, another member of staff reports on the images. Therefore, they will not be able to provide you with any indication of the results at the time of the appointment. A report will be provided to your referring doctor following the exam. The hospital will provide you with information on their specific requirements. Further information on radiation risk can be found in this leaflet or on this website. We hope that this video has answered your questions. However, if you would like to make any suggestions for future improvements, please see this website.